Hi, my name is Dr. Alexa Parker, and this is Dr. John Parker. In our office, we do a lot of functional nutrition, and we help patients with different chronic things. Particularly, we do see a lot of adrenal fatigue in our office, and generally, a lot of the pattern looks like, a lot of difficulty getting out of bed in the morning. We find that patients have to, hit multiple snooze and alarm clocks in order to get out of bed. They're tired in the morning. They have a lot of trouble getting out of bed. They also sometimes have fatigue after lunch, but then they can't sleep at night, so they're wide awake at night. Their cortisol levels are really high. That's kind of an example of what we see with adrenal fatigue, but there's a lot of other symptoms too, like brain fog, mental fog, depression, anxiety. So Doc, what do you see?
When we work with people that have chronic fatigue, they have adrenal fatigue, we look for things that are really, how wiped out are their adrenals? That's probably the number one place we look. So your adrenals release cortisol in a specific night and day rhythm, and in the morning time you should have high cortisol, carry you through the day, it dips down, time to go to bed, your adrenals should follow. They also can have a hormone shift. So a lot of times when we work with that, we'll work with people who run an adrenal stress index. We look at blood sugar. Sometimes people have dysregulation of their blood sugar and they have a lot of brain fatigue, just can't get it together, and they tell me all the time, I'm not like I used to be. So chronic fatigue is a big one when we look at the adrenals for sure.
Yeah, we always look at the underlying causes. For example, we see a lot of viral infections influencing the adrenals, bacterias, chemicals, funguses.
Emotional stress.
Absolutely, emotional stress. And like you said, blood sugar is huge. Yeah. It's the number one stressor in the body, and we know that can't work properly when you have adrenal fatigue. So we work hard to really help patients with adrenal fatigue because we know that we can really make a huge improvement in their life.
So if you're having issues with energy, chronic fatigue, feeling run down all the time, come in. Let's see what we can do to help you. Look for hidden anemias, adrenal problems, things like that. And we look forward to seeing you come in our office.
We look forward to helping you.